Well, hey guys, welcome back to another episode of the AltMed podcast series. With me, as always, my co-host Mitch Kurtz is in
Hello.
the house, and it is our pleasure today to have the lovely Cassandra Hunt from Freshleaf Analytics joining us. Welcome, Cass.
Thank you. Thanks for inviting me to come and chat.
Thanks
Our
for
pleasure.
being had.
All right, am I kicking off or you, Mitch? Because we've got plenty of questions for you, Cass. But I can see Mitch is getting.
Oh, no,
very excited.
I'm excited by this one. I don't mind a few data, a bit of analytics, a little bit of stats. So I'm excited.
Indeed.
But I think it's definitely always good to start off with a little bit of background for those those few people out there that may not know who you are.
And you have to talk about, we need to hear about your time at Time magazine, how you've gone from paper to plants. We want to hear all about that journey.
Let her do it, Andrew.
Do you want me to just talk a little bit about Freshleaf?
We'd love to talk about where you came from, and then also, definitely what's happening at Freshleaf.
Okay, cool. All right. Well, I'll start with Freshleaf. So for those of you who aren't familiar with us, we are sort of the leading provider of data and intelligence on medicinal cannabis in the industry in Australia. And so we put out market reports twice a year that sort of talk about the state of play in the industry. And those reports are free for download on our website for anyone who wants to read them. And then we work a lot with companies in the industry and outside of the industry to help them kind of understand what the industry looks like, how they might enter the market, how they might succeed in the market, that sort of thing. So that's us and what we do. As you mentioned, Andrew, I started my career in magazines. And so that was back in the 90s when it was pretty fun to be a 20-something working in the magazine industry. So I was doing market research and marketing and then working for lots of titles like Who Magazine, Sports Illustrated, InStyle, and then of course Time. And so I, after a few years, moved across to Time magazine where I ran their marketing for Australia and New Zealand. And really loved it, absolutely loved that magazine and still have a very special place for it in my heart. And after 8 years in magazines, I decided it was time to do something a little bit different. And I was flicking through sort of job ads and I saw an ad that just said, bravery, passion, action, freshness, love, innovation superstars wanted. And I looked at it and thought, I have no idea what that even means, but I really like those words. And I found my way to an amazing innovation agency called What If Innovation and spent lots of time working with them, initially working on projects to invent new products and services and customer experiences and things like that. And traveled the world doing it, came back to Australia and sort of ended up doing more strategic sort of vision work where we were helping companies invent new futures, essentially. So imagine what a more desirable future might look like and developing strategies to get there. And so, so I did a lot in the healthcare space, absolutely loved healthcare, loved the idea of a sort of burgeoning industry. And when I learned about medicinal cannabis, I kind of thought that would be a really interesting place to play next.
That's wow. And so I know that medicinal cannabis has obviously been so prevalent in other parts of the world long before Australia, but I think really things got going here in 2016, say, when the Victorian government, I think, was the first, and then that sort of followed like dominoes the other states and territories. But at what point did you sort of jump into the Australian market? Are you someone that was there sort of right from the start, or did you come to it more recently?
Yeah, so I formally joined the market just at the beginning of last year, or just sort of after COVID hit, actually. I'd been researching the market before that, and actually just before COVID hit, I decided to take myself over to Canada on a bit of a research trip. And my dad is Canadian and a businessman, really interested in business. And so I said to him, do you want to come with me? So I took my now 80-year-old dad on a plane over to Canada just before COVID hit, as I mentioned, and had this big itinerary planned out. So day one in Vancouver, I dragged him to 10 different dispensaries from the sort of high end to the low end. And then we went and visited some manufacturers and some cultivators and did all sorts of cool stuff when we were there. So that was a pretty amazing adventure.
They're all the high end, or is it?
They're not. No, they're not. Well, no, they're not all high end.
Yes,
Depends on your definition of high end, I suppose.
Yeah.
You end up high.
No, that's really cool. So you're in that, and then did you basically saw how things were going there, and then you came back to Australia and you just thought, wow, we're a little way off where Canada is. Have you sort of come in terms of, you talked about when you were at What If, you were imagining what the future might look like for certain industries and for certain companies. Was that like a peek inside the future when you were in Canada, or do you see that the Australian market is kind of going in a bit of a different direction?
Yeah, look, I think that's an interesting question, because I think from the outside in, you know, I would see what was happening in places like Canada and the US, and you expect that Australia will follow suit. And now I understand the market a lot better. I realize that it is very different here, and I don't expect that we will necessarily follow in the footsteps. In fact, it's interesting. I was thinking about one of my favorite dispensaries in Vancouver, and it was a really beautifully done dispensary that had sort of, I guess, more wellness products up at the front, and lots of education and cookbooks and those sorts of things. And then there's sort of the dispensary was at the back. But when I was chatting to the person who worked there, she was saying that she felt the Canadian market had gone too recreational, that they'd actually turned the dial too far in that direction. Yeah. I don't think that's a risk here in Australia. I think that the approach we've taken is so different. I mean, you know, so yeah, I can see the influences. I can see lots of stuff that's happening in Canada happening here, but I don't think that we're going to follow in their footsteps like that.
Yeah, I agree with that. It's very highly regulated and very pharmaceutical here, it would seem. But so perhaps, I mean, Mitch and I love the Freshleaf reports. They're great. What are some of the trends, or what's some of the data that has sort of piqued your interest that you've seen? I know it must be that there must be so much, given that every sort of second post with half the people I follow on LinkedIn is, we've got record numbers of approvals for the special access scheme, or it's just growing at this phenomenal rate. But what's caught your eye in the last sort of year or so?
Yeah, so it is growing at a phenomenal rate, and you see those graphs that just have bar charts, going up and up and up. And there's no other industry that's quite like it. It's small, obviously, still. So we've got a way to go. But we've seen, last year in terms of product revenues, that we ended the year at about 100 million. That was more than triple the year before, which ended at 30 million. And we're forecasting that this year we'll see product revenues sort of jump to over 200 million. So we're seeing really steady growth. Obviously, that's being driven by patients who are buying those products, and so we're seeing patient numbers jump, in the same way. Even at the end of last year, there were around 30,000 active patients, and so they're patients who have been to see a doctor or filled a prescription in the last month. So we were at 30,000 patients in December. We're up at around 60,000 patients now. So that's, double the number of active patients in just a 6-month period. So we're expecting that we'll see, we'll continue to see that growth trajectory. That's been mirrored, obviously, in SASB approval numbers. I know that's been in the media a lot lately, because they've sort of been, they've been moving around a bit, the SASB numbers, since sort of February of this year. So we've seen 2 really big spikes this year, and then we've seen it drop, and then we've seen it come back again. And we've been watching those numbers quite closely. It looks like they're stabilizing a little bit now at around between 9,000 and 10,000 approvals a month. And to put that into context, in February, which was a record month at just around 10,000, the previous 12-month average was 5,000. So we have seen a big jump up in those approvals. And there were a couple of things that were happening earlier in this year that meant those numbers were, we couldn't tell if they were being artificially inflated or if there was genuine growth. There were things like the flower shortage, which meant that doctors were having to do multiple SASB approvals. And so whilst the numbers were high, it didn't necessarily represent patients. So we've been watching those numbers really closely to try and figure out as you know, if flower rectifies itself and there were some problems with TGA systems and those sorts of things, whether or not that number would come closer to the 5,000 or stay up sort of, you know, near the 10. There's lots of really encouraging growth signals. The other one would be authorized prescribers, and that's a really interesting one to watch too from a trend perspective, because a couple of years ago, would have been December 2019, there were 29 authorized prescribers, and it stayed very, very static for a long time. And we've seen quite a big jump up over the last year. Again, it's still small, but we've now got 269 authorized prescribers. And that's a really significant number, because they're the people who have made an effort to apply to be able to prescribe to multiple patients without having to get a per patient approval. And so it sort of represents people who want to, or doctors who want to prescribe in that volume. And so obviously that's different to SASB, which is a, you know, per patient approval. And so, yeah, so that's another one to keep a close eye on.
Yeah.
And
do you have,
oh, sorry, I'm peppering with lots of questions. I'll let you have a go, Mitch.
yeah, I'm actually part of this too, mate. Do you have a lot of visibility over the figures that APs do in the authorized prescribers over like patients that they see or scripts that they write?
Yeah, so the APs do have to report on their prescribing patterns a couple of times a year to TGA, and we can access that data. So it is possible to get it through, you know, a freedom of information request, for example. So there is information there. I actually just don't have the numbers to hand in terms of how many patients on average per authorized prescriber, but that is something that is, you know, that is readily available data.
Yeah, that would, I think, be interesting to look at as well, because if we think about, we see the SaaS, you know, new 10,000 this month, or up from 5,000, for example. But I feel like the authorized prescribers are the, you know, once they're in that pattern, they're the ones doing the volume in my head, I would imagine, of scripts out there, possibly beyond the SaaS portal.
Are you saying that, Mitch, because they're, you know, so say an authorized prescriber working at a specialist cannabis clinic, you know, they're going to be ones that are seeing patients who are clearly, you know, have expressed an interest in getting a medicinal cannabis treatment?
Yeah, I would imagine that the bulk of the scripts in this country are going through that mode at the moment, rather than the doctor who is writing, you know, maybe 2 or 3 scripts a week or a month through the SaaS platform. Would be my...
And it's not just the specialist clinics. So, you know, GPs, for example, who, you know, have embraced medicinal cannabis as a treatment option and are prescribing to patients, will seek AP. And there's been some changes recently to the AP process, which will hopefully make it easier for some of those doctors to at least get through the first hurdle of becoming an authorized prescriber, which is sort of at that ethics committee application level, where, you know, you'd traditionally have to specify a product and an indication that you want to be able to prescribe for, and they've changed that now so that you're applying to prescribe a schedule, so Schedule 4 or a Schedule 8. So that will hopefully make it a little less onerous. They've also made the approvals last for longer, up to 5 years instead of up to 1 or 2. So I'd expect that we will see those authorized prescribers, you know, not only have we seen natural growth, but I think that we'll see some more growth now that some of the barriers have been removed for doctors in getting that status.
Absolutely. Big shout out to Brian Walker, who I think led a lot of that. I saw his speech in the WA Parliament where he talked about, as a prescribing doctor, how ridiculous it was that, you know, he would only be confined to be able to specify, you know, prescribe a specified set of products, and, Yeah, no, there's been a lot of great work behind the scenes to improve access. And then of course there's the third channel, which I don't think gets as much airtime, but I imagine a lot of scripts are also coming from the compounded route as well. And that's very difficult. I don't think you're a much better place for me to comment on this, but is that data available at all?
No, so we don't report on compounding numbers, and the reason is that there's no system in place that requires that to be reported, and so there's nowhere that data is being captured. We know that it is used a lot because doctors don't have to go through the same sort of approval process that they do otherwise, and so that is absolutely a growing channel, but being able to put a number on that becomes quite difficult because of the accessibility of the data and the way that it's structured.
Yeah. Do we have an estimate? Is there any kind of anyone out there doing an estimate on what percentage of the market might be compounded?
So no one's put an estimate into the public space.
Yeah.
Okay.
Well handled, Kath. I can see Mitch is sitting there with his fishing rod. Just
No, I'm not. But I would say that in terms of no instrument to kind of collate that data, I would imagine they would still have to submit that on the drug of dependency kind of record. So there would at least S8s.
Oh, so you're saying like state-based record keeping obligations?
Yeah, I would.
Or pharmacy.
Yeah. I think it's an unknown though. At least with AP SaaS, as you alluded to, Cass, you can put in an FOI request to the TGA to get that data. Are you seeing, one thing that I'm interested in is just the, I guess, just segments of the population that are approaching it. I know that there's some information that came out from our friends at Cannabis recently about the growth in young men who are seeking access to flower. That doesn't quite surprise me, maybe as much as it should. But have you seen any other interesting kind of demographic trends in terms of who is actually accessing medicinal cannabis in Australia?
Yes, so I think so. We have seen it move younger, as you've mentioned, and we've seen a slight movement towards men accessing medicinal cannabis, which is possibly hand in hand with what's going on with flower. So they're the biggest shifts, but actually I think that we haven't seen the shifts that you've seen in Canada, for example, where you're starting to see a lot more middle-aged people who are accessing cannabis, and a lot of that is also to do with the different delivery formats that are available. And so, people who maybe weren't comfortable smoking a joint or using a flower product, had alternate options that are still sort of, kind of not black market or baking something into a brownie or, that type of thing. So we haven't seen the same demographic shifts yet here that we've seen there. I do think that they will come as that is something I think that we'll see happen, here, that's happened in Canada. And I think it will come as the market matures a little bit and the stigma disappears more. I think that we are still in a space where people are coming to terms with needing to reorient their brains around cannabis not being an illicit drug, but actually being, something that has true, medicinal benefit for many patients. And so, I think that those changes will come, but we haven't seen them yet.
Yeah, absolutely. And in terms of, in that, talking about that, the maturation of the market, pricing, what info can you tell us about pricing? It's obviously one of the hot topics around cannabis, especially in the early days, super expensive, still quite expensive in a lot of circumstances. What kind of trends are we seeing with that, and where can we expect it to go, do you think?
Yeah, so at the moment, patients on average are spending about $359 a month on cannabis, and we've seen that drop over the last 6 months or so from $389. So we've seen a small drop there. We have seen pretty big drops in price overall over the last 3 years. So the cheapest product that you can get on the market at the moment is around 3 cents a milligram, and that is a CBD isolate product. If I was chatting to you 6 months ago, I would have told you that the cheapest product was 6 cents a milligram. So we've seen a really big drop in just 6 months. You know, the floor price has halved. That's not all products though. So, you know, people often say, how come it's still so expensive, but you're telling us it's the cheapest it's ever been. So the average price for sort of all products is around 16 cents a milligram at the moment. So whilst there are cheap products available, it's not the bulk of the market, and it doesn't necessarily mean that those products are being prescribed. I think the challenge that we've got in this market is it is so crowded. I was describing it to someone the other day because the market's still small, right? But there's loads of people kind of trying to come in and get a piece of the action, seeing what's happening in places like Canada and the US. And I was describing it as it's like seagulls fighting over a chip. And there are currently like 190 odd products in the market for doctors to choose from. And so, you know, not only does a doctor have to keep learning it was 150 6 months ago. So that's 40 new products that you need to try and get your head around in 6 months. And what we know about prescribing patterns is that doctors will, you know, they tend to stick with the tried and tested. And so, you know, if they've started off prescribing a lot of oil and flower, which is still the predominant formats that are being prescribed, then, you know, they may stick with those. And if they know that they've got patients who have had successful outcomes using those products, that they've got to have a very good reason to suddenly start prescribing something different. Now, price is absolutely a factor, and we know that, you know, after doctors have done their clinical assessment, they've understood whether or not a patient is going to need to drive and operate heavy machinery and all of those sorts of things. Price is a you know, key factor in deciding what to prescribe. But what we're hearing is that the doctors aren't necessarily jumping to those 3 cents, you know, a milligram level products straight away. And there'll be lots of reasons for that. They might not know about them, as I said, or they might be concerned about the quality of them, or they might just be sticking with the ones that they know. So yeah, and in terms of where we think this will go, we think there is still room for the price to keep dropping. It kind of needs to be. It's not that far off though what people are prepared to pay on the black market. So the CAMS 18 study showed that people on average were willing to pay about $50 a week. And we're paying about $50 a week, and so we're not really, you know, we're not too far off that when you look at the sort of cheaper products that are available in the market.
It's interesting too that some of those, things like the basic products of an isolate in an oil, just the price disparity between different product providers. You know, it's like it's the same product, guys. It's really quite astonishing how much at the top end, how much gouging goes on. I really do feel, you know, I'm in some CBD groups in Facebook, and you know, people are, unfortunately, depending on which clinic they go to, you know, they can have a very different outcome in terms of what they're going to end up with as a monthly ongoing cost for medication. And so with that, you talked about in the last, I think, 6 months, there's been another 40 products flood the already existing seagull space. But how much of those products are flower? Like, is the flower trend continuing, do you think? Are people starting to opt more for that over oil?
Yeah, so the flower trend is continuing. Oil is still the primary format. In terms of the actual products available in the market, maybe 1 in 5 is a flower product at the moment, but we are seeing that grow, and we know that prescriptions for flower are growing. So yeah, and we expect that to continue for a while. Particularly, there's you know, there's a sense that is some of the people who maybe were accessing products before on the black market going through legitimate channels. There's still a very big black market, green market, whatever you want to call it, and so I do expect that will continue to see growth in that area. And you know, it's interesting, this sort of, when you look at the price disparity, they are the same product, although it does remind me a bit of that ad. I'm showing my age now, which was like the oils ain't oils ad. Do you remember that one? Which was sort of saying how, it was Valvoline, that's it. And so kind of saying, like just because they're both oil doesn't mean they're necessarily the same quality. And I don't know that there's understanding of that in the market yet. I don't think the market's ready for those types of messages yet. Actually, I think we're still, by and large, getting our heads around the idea of medical cannabis and just sort of, CBD versus THC and other cannabinoids. So that's interesting. I was just going to say that.
Oh, sorry, you go.
You go. I was just going to say the other thing is, for some of the manufacturers, particularly in Australia, and a lot of the products are still brought in from overseas, but, these companies got the licenses a couple of years ago. Some of them have spent a lot of money on, infrastructure and facilities, and GMP, is not cheap. And so those companies are needing to factor all of that investment into their pricing. And I think it's going to be difficult for them to, to bring the prices down if they're still trying to, kind of manage the impact of that sort of early investment when the price was, the prices like dropped fivefold, probably more than that, since the inception of the industry. So
totally.
That's tough.
And same, and it's a trend that can be observed in, looking at the price of, say, CBD isolate products in the US, in Canada. So it is amazing. I mean, yeah, I feel like there's only a finite amount of time for these companies to continue to sort of have a fairly high entry price point for their products, even if it is to recoup on that early investment. I was just going to say before that, and this is probably a great question for you as someone who comes from an innovation background, but I agree that I don't think we're ready for that more nuanced messaging around oils ain't oils and what actually makes a good full spectrum product versus a sort of average one that's effectively just a whole plant extract that calls itself full spectrum. But yeah, if we're all constrained, I feel, by the current advertising restrictions which apply to unapproved therapeutic goods, and that's all policed by the TGA. But I was just thinking it would be fascinating to see if the industry was able to both advertise products, talk about products, what makes one product seemingly better than another. It'd be fascinating to be hearing the industry talk about itself in that way. And I'm sure one day we'll get there. But do you have any thoughts, without taking you anywhere near any advertising
that minefield?
Yeah, the court controversy. Do you have any thoughts around that and what companies are thinking in that space of why their product is better than another product?
Yeah, I think that a lot of companies have trouble articulating that, and which I think is particularly tricky in a market that is, it's heavily commoditized. You've got a lot of, 65% of the 190 products are oil products. And as you said, it's not necessarily easy to see the difference between them. And that's why, and I've talked a little bit in the past about, I always talk about innovation because I'm passionate about innovation, the companies need to be able to find a way to meaningfully differentiate themselves. And I use the word meaningful differentiation because that's the really important bit. It's about tapping into an unmet or underserved need for a patient or a doctor, and being able to come up with a product or an experience or a way to access the product that will genuinely create new value for someone. And that's how you differentiate. That's how you need to innovate. And I think the thing with innovation too, and this isn't a cannabis industry thing, this isn't like all industry thing, and there's lots of research that's been done on this, is when you hear the word innovation, people think product, and product is just one very small type of innovation. And there's a model that I've always loved using, which is it was started by a company called Dublin. It was subsequently bought by Deloitte. and it's called the 10 types of innovation. And they talk about, you know, innovation being not only what you offer people, but how you configure your business for that offer, and then how you get that offer to market. And thinking about innovation in all of those spaces is really important. And the other thing that I would say is planning for the innovation to gain traction. So just because you put something new and innovative in the market that has genuine new value for a patient or a doctor, it doesn't mean it's going to automatically be successful. And you've got to plan for the adoption of that innovation. And there's a theory called the diffusion theory, which sort of looks at the speed of adoption for new innovation. And so I think we've also got to, you know, when we're putting new stuff into the market, regardless of what type of innovation it is, we've got to be thinking about, you know, what does that adoption curve look like, and also acknowledging that it's not going to be an overnight. It's not going to, you know, take hold overnight.
Definitely. Mitch, you've got the mute on.
Yeah, I had a bit of wind going on here, so I thought I wouldn't trouble our listeners with that. But in terms of innovation, I also want to know your thoughts on ecosystem leadership. Definitely something that we chatted about earlier, and I wanted to hear a little bit about your thoughts on that as well in the cannabis space.
Yeah, so in my previous life, I spent quite a lot of time thinking about ecosystems and designing ecosystems. And what I find really interesting about the medicinal cannabis industry and ecosystem is it's so young, and it's developing, and the market changes so quickly. So the job of the people in the industry is to read and respond to those changing signals, obviously, as quickly as they can, and forge a new direction. And the leadership piece in that for me is that the people that are playing in the industry now, are the ones who have the responsibility of shaping what the industry looks like in the future. And so, you know, I believe that we've got to take a sense of sort of responsibility and good citizenship to that. And we need to be making decisions about how we build our businesses so that it is for the good of the industry, and we build the reputation of the industry. You know, we're from a reputation perspective, we're coming from a place where, you know, cannabis is a bit behind. We do have stigma. People, you know, are still kind of raising their eyebrow from time to time. And so, you know, as people in the industry, if we make decisions about designing our futures in ways that are responsible, then we'll be able to grow the industry in a way that's really positive. And I think that anytime someone does something that detracts from that, it makes the job for everybody else harder. And so that to me is ecosystem leadership. It's taking a really strong sense of purpose to creating new value in the industry and having that sense of collective responsibility around it.
Yeah, absolutely.
And then there's a tension there, because you have each of those individual participants all trying to pioneer their own path and be the sort of the king of the castle. But I agree that sort of collective leadership is required. I know there was a sort of, at least in the industry circles, was it when that group up in Queensland started offering shorter consults to patients to access CBD, that ruffled a few feathers, because on the one hand you have, very much something I agree with, which is that you're trying to improve patient access and remove barriers. But then on the other hand, you have the rest of the industry saying, well, technically we're trying to play ball, and we have all of these guidelines around things that we need to check off in a consultation, and we're spending 30 minutes per patient, and they're sort of accelerating that in order to increase their volume. So yeah, the tension of how that actually all plays out is something that I find quite interesting. But it is good generally to see the industry moving together as one, and having generally, I think everyone's on the same page. We want to see affordability improve, well, most of us do, and we want to see it prevent it. We want to see the stigmatization stopped. We want to see people in government take it seriously, and some of us, I don't know if I speak for that many in the industry, but some of us want to also see, a bit of a homegrown amnesty, and people who are able to have their own recreational arrangements. But yeah, it is all moving as one. I think generally speaking.
Yeah. Go ahead, Mitch.
I was just going to say, and I think we're kind of seeing that as a result of some of the innovation already, and of some of the people taking a bit of a leadership stance, and we see that in very small steps, but like such as the S3 kind of move to S3, even though we don't have any products just yet actually qualify.
Yeah.
We do see at least a framework being laid that we will be able to utilize in the future in order to increase that access as a result of people taking a bit of a stand and calling for that. So any thoughts on that in particular, the S3 thing? I mean, it's a hot topic, has been for a while.
So look, so we've been working on S3 for a while with some of our clients, and look, it is absolutely a step forward for industry and for patients to be able to access those low dose CBD products, much more easily than they can at the moment. The requirement to get a product registered for Schedule 3 in terms of the research and the manufacturing and demonstrating efficacy, etc. It's a long road, and it is a lot for industry. I think that a lot of people in the industry, who haven't come from pharma backgrounds, are needing to sort of learn how to navigate that. And the budgets too, like it's not, doing the sort of research that's required to get those products to market isn't a cheap exercise. So, it's unfortunate that we're looking at a road that is potentially a long and expensive one for industry players, and that whilst it's technically legal for patients to access products through that pharmacy channel, it's going to be a long while, I think, before we see those products on the shelves. I think that's the disappointing part of the down scheduling.
And it's the shelves behind the counter. People have this idea of, it's going to be in pharmacies just sitting next to the fish oil. No, it's not. It's going to be just like the Codurals and the Ventolins, where you actually have to go up and, well, I don't know if it's the case for Ventolins, but anytime you want to even get a Sudafed now, you have to hand over your license. So it's not like any of this stuff is going to be visible to the public. We're just simply trying to find a way to remove the step of having a doctor involved in your access to cannabis. But even this is it's been so hard fought, and something which the government is really digging their heels in on, needing to have comprehensive clinical trials run in respect of. And it'll be a very interesting space to watch. But I'd really just I'd like to see it on the shelves next to fish oil, a CBD dominant product that's 98% or more. I really find it fascinating that we don't have that, and you must as well, after all your trips to the high and low end dispensaries in Vancouver,
in Canada.
I mean, I don't disagree with the approach of of wanting to prove something to be safe and efficacious. Absolutely, like take that for granted. I think sometimes living in Australia, but at the same time, it's not something that you see the harm profile of like you do other drugs, CBD especially. You just don't see people strung out on the streets.
Well, I think you have to hand over your license for Sudafed because they're worried you're going to make meth with it or something. And if anyone,
that's right, yeah.
If you can make meth with CBD oil, then you're a very talented pharmacist, I think. But
look, I agree, Mitch. I think the silver lining in all of this is that it's really up to the ante on the research conversation, and the industry does need more research, and there hasn't been as much of an impetus to do that research, particularly in overseas markets where it's much easier to get these products to people, and without going to the expense and the sort of time that's required to do it. So I do think that that's a really positive outcome from, S3, and I do think that it will be good for the longer term for the industry. But in the meantime, it would be really nice to be able to, improve access for patients in pharmacies.
Yeah,
absolutely.
Wholeheartedly agree.
Now, we do have a question which we have asked a lot of our guests, and I don't know. I think we couldn't have anyone more better placed to answer this than you, Cass, to be honest. As somebody that studies all the data, where is this going, Andrew? No, we want to know if you have a prediction on when you think Australia might, if it does, go recreational.
Yeah. All right. So I'm not going to give you a number. I'm sorry, but my sense is that it will happen eventually, and I think that we are likely to follow a model that is a bit more like the one that New Zealand put forward, that has the sort of social good at its heart. So it's balancing kind of both. In terms of when that happens, I don't think it's going to be quick. So I'm not expecting, at this stage, we're thinking S3 products will probably be on the market in 2023. I'm not imagining that the recreational market's going to be hitting any time too soon.
What about rec CBD?
Rec CBD. Yeah, I don't know. I'm not sure the rec conversation will be split, and I'm not sure it should be split.
Ooh, that's a different view to many we've had, actually. I think there's a lot of people that think that CBD would follow maybe more of a European model, where novel food type.
Okay. So this is language. So I absolutely see a role for CBD wellness.
Right.
But to me, that's different than rec. So there's a market, in my view, that sits in between medical and rec, which is wellness. So I do think that we'll see that wellness market pop up before we see rec.
Okay. Yeah, which is, no, I like that. Conceptually, I've always tried to find a way to think about that, but it's basically, if you don't require CBD to treat a condition, but you identify that there are health benefits to you for taking it, like you would a vitamin or a supplement, that really, is that what you're referring to in that wellness category?
Yeah.
That sort of proactive health approach. Yeah, I
exactly.
like that. Yeah. And we'd love to, I think that's, so that might come, hopefully. I mean, we've had a few people posit a guess of within the next 5 years, but it's work at this point in time. But I think once we start to see a bit of a normalizing of people going to their pharmacy, even if it's not visible, and they're getting their product, and it's just, there's more visibility, people will be maybe taking their oil out in public. And I think once we see more of that, that just pushes everything towards that hopefully inevitable conclusion. But I do share your skepticism about THC.
Yeah. And look, I really, I'd really like to see that wellness market emerge in Australia, because I do think that it could do a lot of good. But the TGA have got to be prepared to unschedule CBD completely. And given that we're talking about Schedule 3 at the moment, it does feel like that's a little way off. But maybe once some of the research is done around CBD and it shows that it is safe and those sorts of things, maybe there'll be more comfort around unscheduling CBD at low doses. So it's we're on a journey, and just hopefully it will start to speed up a little bit versus where it is now.
Absolutely. We might wrap it up there, Cass, because I'm mindful we've taken a bit of your time, but it's been an absolute pleasure to chat with you today, to get all of your industry insights. And I mean, really the key takeaway for anyone listening, I'm sure, is just that this thing is just growing at such a rapid pace. And that's just exciting for everyone involved in this industry. And I'm sure we'd love to have you back on to share your insights as the journey goes on. So we'll we'd love to talk again in a little while. But it's been great hearing from you. So thank you so much for joining us.
No, my pleasure. It's been really fun to chat, and I'm happy to pop back anytime.
Thank you so much.
And bi-weekly.
Yeah, bi-weekly.
Biannually.
Yeah. And for all those out there who enjoyed this one and enjoying the podcast series, please don't forget to hit like and subscribe. We love building that list, and we're going to continue to bring heaps of content to you. So we hope you enjoyed this one. We certainly did. And with that, Cass, we'll say take care, and we'll talk to you soon. Looking forward to it.
Thanks. Speak soon, guys. Take care.
Yes. Cheers.
Bye.